Hey there, my name is Dr. Matthew Brackney, and this is Spine and Sports Therapy Kingwood, your one-stop shop for injury prevention, sports medicine, functional therapy. Today we're going to be going over a foam rolling exercise for the IT band. IT band is an acronym. It stands for iliotibial tract. It's actually a big, thick tendon, essentially, that connects two muscles up here in the hip down into the outside of the knee. Those two muscles are a small side hip flexor called the tensor fascia lata and the glute max muscle. Those two muscles come into this big thick tendon, and it comes down and inserts down here into the side of the knee. The IT band is a common area of complaint for a lot of distance runners, cyclists, and a lot of athletes that participate in running. Now I will say this about the IT band. Oftentimes, where someone has the pain is not where the problem is. Oftentimes, the problem is somewhere else, but they're feeling the symptoms in this place. I use the analogy of victim and culprit. Oftentimes, what hurts is the victim. The culprits can be other places. So if you have pain in your IT band, know that rolling it can be good, can be helpful, but you may have to identify where the culprits are if you really want to get rid of your pain. That's something I talk about often with patients and clients. But regardless, it is important to roll through this tissue and these muscles to work through them. So we're going to go over that today. The best tool that I've experienced for rolling through the IT band is a foam roller. So we're going to place it on your side next to you, and we're going to get into a sideline position. I place the foam roller right above my knee on the outside part of my thigh, and I simply roll up to my hip area. Now, this tissue, this tendon, the IT band, can be very tender in a lot of people. So if this is the first time you're going to attempt a foam rolling exercise like this, I highly encourage you to use your hands and use your top leg to help support your weight, so you're not putting all of your body weight into your muscle tissue and through this tendon. It can be pretty tender. So just like with any rolling, it's important to start off with getting a wide area and rolling through a lot of the different parts of the muscle. But if you find a particular area that's a little more tight or tender, then give that area a little bit more attention. You can also get here at the top, go over, so my hip bone's right there, go past the hip bone onto the side hip muscle and roll back and forth. And that can get some of that small outside hip flexor that I was talking about that connects into the IT band here. I'm going to switch sides and show you from this way. Again, I'm going to place the foam roller right above my knee on the soft tissue or the muscle, and we're going to roll up towards our hip. Make sure if you rotate your hips up, you'll get more of the back side of the thigh. If you rotate your hips more down, you get more of the front side or part of the quad muscle. As it connects to this IT band, all of that tissue is very connected. And then again, I'm going to go, there's my hip bone there. I'm going to go past my hip bone onto the muscle of my outer hip, and I can roll forwards, backwards, and that can get into some of that hip flexor muscle that inserts into the IT band. So that's the technique, that's the foam rolling exercise. Be sure to try this out. Again, if this is your first time attempting this type of foam rolling exercise, I encourage you to use your hands and your top leg to support your weight so that you can monitor the pressure against the outer thigh. Whenever doing a foam rolling exercise, I tell people to look for what I call medium pressure. You don't want the pressure to be too extreme that you can hardly bear it. You don't want the pressure to be too light that it's just rolling over the top of the skin. So experiment with that. Check it out. Let me know what you think. Place a comment in the comment section below, and I'd love to help troubleshoot any problems you have with that. But anyway, that's it for today. Thanks so much for checking out the video, and be sure to subscribe to our channel. We have a lot of great other videos with similar foam rolling exercises, stretches, core concepts, and injury prevention talks. So hope you enjoyed that, and have a great rest of your day.